So my name is Nadav Davidovitch. I'm the Director of School of Public Health at Ben-Gurion University. What we're going to do now, actually taking many of the themes that emerged already from the wonderful talk of Professor Ellen Brandt yesterday. So the title of our session is Experimenting or Treating, Drawing a Fine Line in Times of a Worldwide Pandemic. So we already discussed the need of bioethics to define a clear line between therapy and experiments. And we also saw from historical perspective that many times this line is a bit shaky. And of course, bringing a pandemic, bringing an emergency, the line is maybe even thinner because you're in an emergency, you don't have enough time. You have also emergency approvals that we're going to hear from Professor Dror Mevorach. But I think in this session there's more than just the question of the pandemic. I'm very happy that it's also a session about public health because we're talking about something that is on a population level. It's not just about treating one person. Of course, one person sick, you know, it's a whole world for him, for her, for the family. But we are talking also about populations. We are talking about inequalities. And all of this relates, I think, to the previous sessions because I think in the previous session we saw what Thomas Kuhn maybe described as you know, the end of a paradigm, like a Ptolemaic system that is about to collapse. This whole tension between the pharmaceutical industry and for-profit versus health that is about human rights. And these tensions, I think, also emerged during the pandemic. We just published a paper about the role of Israel in vaccine policy on the global level. Some of the persons in the panel were also interviewed and gave their input. If I remember correctly, and this is together with Bruce Rosen and others from the Brookdale Institute, I think if you take the high output papers in places like New England, Nature, Lancet, the share of Israeli scientists was about 15%, and that's of course quite incredible. On the other hand, it raised the question why just in COVID and why not in other cases, and we made some comparison to other places. And so you're going to hear about what was unique during COVID. Of course, there are many ethical issues. Unfortunately, still we have vaccine nationalism and not vaccine internationalism. So each country needs to sign its own contract. And I think that probably all of us think that this is not a great idea from a public health perspective because you want to have vaccines available for everybody if you want to deal with the pandemic, again, from a population perspective. So these are some of the themes we're going to discuss. I need to say that I was a bit afraid and some people wanted to come here, people that are very critical, and I hope that the whole discussion will be, you know, civilized. We must say also that Dr. Sharon Honorary-Price had, I don't know if you still have an escort. Okay, so I'm happy, and she and many others here, including myself, were called the Nazi physicians, and Dr. Mengele and all of that. So the whole atmosphere surrounding the pandemic and vaccination especially was really very, very, very intense. And when we're talking about some lines that were crossed, this was definitely a line that was crossed. Lots of burnout among people that were working day and night, and it's not enough to clap. We need to invest in public health.